This video is about Sgarbossa criteria, which was originally developed to predict myocardial infarction in patients with LBBB pattern or ventricular paced rhythm. If you see the two waves which are present here, the EKG waves in V1 and V6 in left bundle branch block, the QRS and the ST and T waves, they are opposite to each other in both V1 and V6. This happens because of abnormal depolarization followed by abnormal repolarization, resulting in the QRS and STT segments to be opposite to each other. This discordance is normal, and it is called as appropriate discordance, which occurs in LBBB and ventricular paced rhythm. Because it is difficult to predict ST elevation or ST depression, which normally occurs in MI, the Sgarbossa criteria was developed. It was developed by a physician named Ellen B. Sgarbossa in 1996. So, according to this criteria, the ST elevation or the ST depression should follow certain criteria to be diagnosed as MI in a pre-existing LBBB or a ventricular paced rhythm. The first criteria is concordant ST elevation of more than 1 mm in leads with a positive QRS complex. This gives a score of 5. If you check the EKG wave which I denoted here, the QRS complex is positive and the ST segment is also in a positive direction. When both are positive, both the QRS and the ST, they are positive, it's called as concordance or concordant ST elevation, both in same direction. In the same way, the second criteria is concordant ST depression of more than 1 mm in leads V1 to V3. So if you see here, both the QRS and the ST both are in negative direction, which means the ST is depressed, but it is concordant or is in the same direction of QRS. So this concordant ST depression should occur in the leads V1 to V3, which gives it a score of 3. The third important criteria is excessively discordant ST elevation. When you say discordant, that means the QRS and the ST both are in opposite direction as indicated in here. This criteria also says that this ST elevation should be more than or equal to 5 mm in leads with a negative QRS complex, which gives it a score of 3 again. So, if you calculate the score of 1, 2 and 3 criteria, the total score is more than 3 or equal to 3. That means that EKG has more than 90% specificity of having MI. Although these features, they are specific, they lack sensitivity. The sensitivity of this criteria is around 30% only. So, Smith has modified the Sgarbossa criteria. There is a reason for this modification of the original Sgarbossa criteria. That's because the rule 3, that is this excessive discordant rule, is not applicable in all cases, because the ST elevation of more than 5 mm, it normally occurs as well in patients with LBBB due to large voltages. Therefore, Smith has modified the Sgarbossa criteria and named it as Smith modified Sgarbossa criteria, which includes the 3 new rules, that is concordant ST elevation of more than 1 mm or equal to 1 mm in more than one lead, concordant ST depression, which again means QRS and ST both are depressed of more than or equal to 1 mm in more than or equal to 1 lead in V1 to V3. The third criteria was changed as proportionally excessive discordance of ST elevation in more than one lead with more than 1 mm ST elevation, and this ST elevation should be more than or equal to 25% of the preceding S wave.